So examination of for abdominal examination of a pregnant woman, the materials we need is just the tape rule and the penile stethoscope. Okay. So first of all, you explain the procedure to the woman in order for you to gain consent, and also gain her cooperation. Then you tell her to go and empty her bladder, so that to prevent any discomfort by the time you start palpating, especially at the pelvic region. Then you ask her about her last menstrual period so that you're able to calculate her expected date of delivery and weeks of gestation. Then the woman should be kept comfortably, then with her hands by her side, okay? The hands should not be above her head like this or anywhere, so it should be by her side. So the woman should not be exposed undue, meaning that you only expose only the part that you need to examine, which is the abdomen. So that's what you are going to be exposing. So now, before we start the palpation, we have to inspect. Okay, we have to inspect the abdomen. And what are we checking for in the abdomen? We are checking the for signs of pregnancy, which includes the linea nigra, the stria gravidarum, if they are there. You also check for the size, if it's grossly or moderately enlarged. Then the shape of the abdomen, if it is ovoid, if it is pendulum, or if it is globular. So you check for that. Then you also check for fetal movement. So sometimes you see that the baby is moving. Then for skin changes also, you check for stria gravidarum, check for linea nigra. Then you also check for previous scars and also scarification on the abdomen before you now move over to the palpation. Now in the palpation, you check for the fundal palpation. The fundus is here, just after this xylosternum. So you put your hands like this. See the way my hands are placed. Then you start going down from the xylosternum down. When you get to a point where you feel there's a mass that you can no longer come down, you know that you have gotten to the fundus. Okay, so you now check for the fundal height. So if it's a fundal height, by placing your tape rule at the fundus where you felt the mass, and also at the symphysis pubis. Then you check. This is giving us 25 cm, meaning that the woman is 25 weeks pregnant. Now we'll now go over to the lateral palpation. So in the lateral palpation, also for the fundal palpation as well, the fundal palpation help us to know the lie of the baby, if it is longitudinal, if it is transverse. And how do you know that? If you start palpating the fundus and you feel a round mass that is hard, you know that that is the head of the baby. So it means that the lie is longitudinal and the presentation is preachy, but the uterus will definitely be down here if the head is at the fundus. Now if you palpate and it is soft, it is soft and it's not as round as the head, you know that it is breech and the baby is presenting with the head or is presenting with a cephalic. Now you now go over to the lateral palpation. You have to check for the fetal back. So you move your hand like this round. Now if let's say you started from this part and this place is smooth, okay, everywhere is smooth, it means that that place is the back of the baby. Okay, so if when you are done with this part and you move to this other end, since you've gotten the back from this side, so definitely the limbs will be here. So this place will not be as smooth as the other end. So you feel for ragged, you feel for the limbs, you feel irregular shape around this part. Now we are done with the lateral palpation. We'll now move over to the pelvic palpation. In the pelvic palpation, see the way my hands are placed. I'm now facing the woman's leg. I'm no longer facing the woman's face. So I will move like this with my hands like this and go over it. Okay? So I will check for whatever that is presenting. So if it is the head, you feel a round mass over it. If it is the buttocks, you also feel the way the buttocks is supposed to present at that part. Now when you are done with the pelvic palpation, go over to auscultation. which is the last part. Now we got our back at this end, and we assume that we got our head, especially if you get your head at the pelvic region, and the back is here. So you are going to be placing this penile stethoscope in between the scapula of the baby. So you know the anatomy of the baby, the back, you're able to, after the head, you should be able to identify where you are supposed to get the scapula of the baby. So that's where you are going to be putting your penile stethoscope. So by the time when you put your penile stethoscope there, you will now place your ear. Okay, then you don't touch the stethoscope so that it doesn't give you an extra noise when you are hearing the fetal heart rate. So but if the intensity of the fetal heart rate is not that much, it's not firm or it's not hard, you have to keep moving until you get to where you can get the fetal heart rate the most. So when you get it, you put your ear like this, and also you don't just start counting. You have to differentiate it between from the fetal heart rate from the maternal heart rate. So you are going to be checking the mother's heart rate so that you be sure there's not the maternal heart rate that you are hearing at the abdomen. Okay, so you put your ear here. So the fetal heart rate is supposed to be faster than the maternal heart rate. So by the time if you are able to differentiate the fetal heart rate and the maternal heart rate, then before you start counting the fetal heart rate for 1 complete minute in order for you to get the fetal heart rate. So when you are done, you remove your spinal stethoscope, you keep, then make the patient, you make the woman to be comfortable, and then you thank her for her cooperation. Thank you.